Staying in contact. I'm London Mitchell. This week, we continue our discussion with representatives from the Lucas County Health Department on a very important topic, the health and well-being of our children. A recent report says the health of U.S. children has deteriorated over the past 17 years, with kids today more likely to have obesity, chronic diseases, and mental health problems like depression. My guests are Dr. Lawrence Monger, Medical Director, and Kendra Kec, Director of Childhood Wellness. There has been a lot of talk about an obesity problem with our youngsters, a lack of exercise, and too much time in front of screens.
We certainly know that, that's so many factors there. Kendra already mentioned access to healthy food. We try to tackle that at various levels, whether it's the WIC program for healthy foods, but it's being able, as you've heard about there being deserts of nutritional deserts. There's so many areas, including here in Lucas County, that don't have access to good, healthy nutrition. And so if you're going to the corner store and there's no fruits and vegetables, and instead you want to buy something, so you're eating chips or candy or drinking pop, from an early age, your obesity levels are going to be higher. You mentioned exercise. So, there's another huge factor. Everyone's in front of a screen these days. When you see an adult come in with a child, and in order to appease the child, they hand them their telephone in the doctor's office and they look at the screen. That's a symptom of something bigger, that the screen is there and is available and easy versus being able to go out and play or having some kind of activity every day. So many factors there, of people not getting enough exercise play a role. You've heard stories of in schools how the physical education time has decreased, and so many factors.
What do you say to the parent who says, all right, my kid's a little chunky now, but he or she will grow out of it? Being heavy as a youngster can have some consequences. Yes.
It absolutely can. And you have to think with the parent, well, why is the child a little chunky? Is the child getting enough activity and exercise every day? We have to be able to have those conversations with those parents. Is the child eating healthy? What are they eating? What are you giving for snacks? As providers, you don't just tell them, they'll grow out of it, because there are lots of factors behind it. And so every time you have an opportunity to talk to a parent about their child's health, we bring up these kind of things. These are regular conversations that people at all facets of healthcare are having with the parents, if we have access to them. So having access to a primary care provider is critical.
Well, you mentioned in our part of our earlier conversation some concern about the changes in the way funding is coming, especially I believe from Medicaid.
Yes.
That may impact the programs that you're offering and your access to parents.
And we've been talking about that at the health department every day. It's coming down the pike, and it's going to be huge. I mean, millions of people being basically taken off of Medicaid rolls and not having access to care. I've been preaching, people need access to health care, and yet more and more people, poor people especially, are not going to have that access. Yes, it's going to play a huge role in children's health. So it's going to do nothing but just make things worse.
Backers of the cuts to Medicaid argue that they're just focusing on waste and abuse and fraud.
Yeah, well, that has been the talking point. It's unfortunately, it's very much a false talking point. Those children are, these are working people who have jobs but still meet the criteria for Medicaid, or mothers of children. You know, there's no waste there. You're just basically, this is the safety net we have for those people who are poor, and we're getting rid of that safety net. So I've heard the talking points. They're just false talking points to cut funds.
The other big issue that was in the report had to do with mental health concerns, especially depression. Either one of you speak to that?
So, especially since COVID, and there have been increased concerns with depression among adolescents. And I do think that some families are accessing mental health care more. We've had to do a lot to work on destigmatizing mental health care. I mean, when I was a child, despite whatever traumas, people didn't seek out mental health care. And now we're really encouraging that. But the trauma that we're seeing in children, and just look at the gun violence statistics alone. I've done some work with Toledo Public Schools, and watching some of these kids come in after a night of gun violence in their community. It's really quite heartbreaking. They can't escape it. And those factors, along with many others, the nonstop social media, that you can't go home and get away from whatever's happening in school that day. It carries on beyond school throughout the evening, with hundreds of people chiming in, whether it's positive or negative. And even if it's accolades, are you becoming addicted to those accolades? Or is it bullying? Whatever it is on social media, we know that kids are drawn to it. So Governor DeWine, in the most recent budget bill they just passed, they're going to be locking cell phones up in the yonder bags in school now, and they're not going to have immediate access to cell phones in Ohio public schools. And hopefully that will help curb some of that activity in the schools. But there are a lot of nuances as to why we may be seeing more depression.
And there are a lot of factors there in depression. If you look at the study, it talks about rates of poor sleep going up. If you're sleeping poorly, that leads to depression. If you're not getting enough sleep, if the quality of your sleep is horrible because you hear your phone dinging, or there's gunshots in your neighborhood, your sleep is going to be poor and your depression is going to go up. Physical activity improves depression. They're so intertwined. So if you're not getting enough physical activity, if you're looking at the phone and looking at all the dings, as Kendra just said, your depression is going to go up. They even measured loneliness in this study, and loneliness rates went up. We're not as much of a community anymore, and so your community is your phone. So all of these things are so intertwined, and it's hard to tackle them all. We're trying to, at the health department, in as many factors as we can, but they're very much intertwined.
And we've seen social media's impact on gun violence in working with the mayor's office on neighborhood safety. The violence interrupters keep a pretty close pulse on what's happening with the gun violence, and if social media has been a part of that, and trying to prevent an additional shooting if a shooting occurs. Social media is one of the first things that they may look at for context and clues. And, over our, I know Mayor Kapsakavich was pretty excited because the shootings were down, and he announced that. And as soon as that happened, then I think we had 7 deaths over the 4th of July weekend, which was just gut-wrenching for all the professionals involved, not to mention the community and the family. And And we're still trying to kind of rally around the why behind all of that. Why is this happening to our families and children? And how do we help make it stop? Because those traumatic events for people that have witnessed them are life altering, and they'll carry those with them for the rest of their lives. And the people that they know.
Almost out of time, but Dr. Monger, if you had a collection of parents in front of you right now, what would you say to those parents?
I think first and foremost, I would say to them, make sure you have a relationship with a provider. Make sure your children have a relationship with a provider for their entire lives. It is so important to get so much of this information from your primary care provider. If you have access, then we can have the discussions before, during, and after pregnancy about sleep. We can talk about someone's weight at any point in their lives. We have great ways to treat, but for prevention purposes, from a standpoint of the Department of Health, have a relationship with a primary care provider. That's my first message. And tell your friends to have a relationship. Tell your cousins and your other extended family members to have a relationship. Do not go without health care.
And certainly if you recognize symptoms of depression or other mental health concerns, no shame in seeking out a professional to help with
Zero shame.
you.
Zero shame. When they come in the office, we screen for that. Every time someone comes in the office, we screen for that. If they bring it up, we're going to talk about it. There is zero shame about seeking out care.
Creating that safe environment for children to talk to someone if there are mental health concerns is of primary importance. And we have a lot of amazing mental health providers in our community that if one doesn't work out, one might not be a fit. You move maybe to the next one, but it's very important. And if there's a mental health crisis or emergency, 988 is a crisis hotline with specialized trained mental health providers that can help families in those instances.
Thank you both for joining me. A lot of valuable information and insight that you've shared. Kendra Kec is the Director of Childhood Wellness with the Lucas County Health Department. She was joined by Medical Director Dr. Lawrence Monger. I'd love to hear from you. Contact me through my website, londonmitchell.news. And please accept this invitation to join us next time as we continue staying in contact.
Previous installments of Staying in Contact with London Mitchell are available on the Stream 419 app, Spotify, and londonmitchell.news.